Good evening and welcome to this WMAY Facebook Live event, a virtual town hall meeting to talk about the coronavirus pandemic, the recent spike in cases locally and around the state, and steps that each of us can take to try to bring this under control. We are honored to be joined this evening by the Sangamon County Director of Public Health, Dr. Gail O'Neill, and the county's medical director, Dr. Vidya Sundareshan, two of the busiest people in our county right now as they are dealing with this surge in cases locally. We're going to begin this evening. Questions that I have and also questions submitted by our listeners at WMAY.com. And we want to start with the County Public Health Director, Gail O'Neill. And Gail, we want to talk about just where we've been and where we are right now. People, of course, have been hearing the stories day in and day out since the start of the pandemic. They know that we got some real improvement in the numbers in late spring, early summer. But in the last few weeks, the numbers have been spiraling to now we've had one-day records 5 times at least in the month of October. We are at a record high of rolling average of new cases daily here in Sangamon County. And we are on the brink of potential new mitigations because of the fact that we have a positivity rate that is approaching 8%. So, Gail, what can you tell us in particular with the data that you get through contact tracing, through your department's investigatory tools as to what's behind this, what's causing this surge? And Gail, we're going to have you unmute yourself if you can. Gail, I'm sorry, you're still muted. If we could.
I think I'm back now. Can you hear me? So we have been, as you said, Jim, that we had a good spell where we were really had our numbers down low or quite a bit lower. And then unfortunately, in the last few weeks, it's been gradually getting worse and worse with the number of people that have tested positive. This is the time when people are trying to go back to school, get kids in school, and to work and everything, and we're seeing increasingly large numbers of people testing positive. For the over the weekend, we had our highest day ever, which was Saturday with 111 cases. The situation is that we have widespread infection throughout our community. So it's when we look at the addresses and the contact tracing, some of it is familial, where it's people in the same household. And that generally happens after someone has tested positive, that we get many members also testing at the same time. We've heard some of this come from weddings and funerals and parties and get-togethers, especially with people that feel like they're in a safe bubble with their friends and family because they know them and they're close to them. But every place people go right now puts them at risk for running into somebody with the coronavirus, the COVID. So we're seeing a big increase in our numbers, and it is concerning to us.
And Gail, my apologies because for whatever reason, I didn't hear all of your answer, and I don't know to what extent you addressed the issue that has become a big hot topic of discussion here around the state, and that, of course, is indoor dining, indoor bar service. The governor has indicated on a statewide basis this is one of the more common elements of people who were testing positive. They're reporting having engaged in indoor dining or going to a bar. What are the numbers and what is the data indicating here in Sangamon County?
Well, we're seeing that, and some of our numbers show that besides the category of no answer or other, that indoor dining and bars and restaurants do seem to be the fourth leading, besides family things, that seems to be the highest risk factor or the common indicator and implicating place that people do gather and spend quite a bit of time together. And they mentioned that they've been at one. So it's something that we don't, um, you know, we don't fill in the blanks. If the people tell us that that's where they believe they've been in the last few weeks or last, week or so, then that's what it's recorded as far as every place they've been when contact tracing is done.
So, and you can't obviously determine exactly where anybody has been infected. You're just really, I guess, looking for sort of these common threads in the massive cases that you're dealing with.
That's correct. Yeah, there's so many that, we just try to find common threads. If it's activities, if it's a particular place, generally it's people that spread this. It's really not a place, but it's a place where people gather. But if it is a place and there's something we can do about that, a lot easier than just people. So that's the information that we get. And it is helpful to know if it is from a family gathering or if there are other people in other counties that need to be contacted. It's kind of the whole picture of trying to reduce the spread.
As you are contact tracing, do you ask and do people indicate whether or not they're regularly wearing masks as they go out to public settings, whether it's a restaurant, a retail establishment, or whatever it might be?
I think they do ask that question. I don't know how many people would say, no, I never wear a mask, or occasionally, or not as well as I should. I know that dealing with businesses who've got employees that they have to decide who is a close contact, and you ask the question of, were you wearing masks? Well, not always. So I think that that's one of those questions where if you find that you're positive, you don't want to admit that you didn't wear it. But so I think that we are finding that mask use isn't enough.
We've got a note, by the way, that Gail O'Neill, the public health director, and Dr. Vidya Sundareshan, the medical director, are both wearing masks here for this event. In fact, are you in with other people in the room with you, or why have you chosen to wear masks for this particular event?
Well, I've chosen to wear the mask because I wear it a lot. I've gotten used to wearing it, actually. So if one of my grandchildren says that you can't breathe through them, I kind of, you really? I was trying to show them that we do that. And it just does become a good reminder that we're trying to fight the battle and be a good example to everyone else in the community. Vidya?
Yeah, thank you for that question. I think we're also wearing a mask to demonstrate that you can talk through these masks, and it's not really difficult to understand anyone, even with these masks on. So yes, to demonstrate that, I think we're specifically wearing it today.
Dr. Vidya Sundareshan is the county's medical director. I want to bring you into this. You and several of your colleagues held a news conference yesterday at the county health department talking about these elevated numbers that we're seeing here locally. And while early on in the pandemic, a lot of the focus was on older people, people with various vulnerabilities, comorbidities is the term that's sometimes used. We have seen more recently, though, a larger number of cases impacting young people, people in their teens, their 20s, their 30s. Even last week, the county reported there was a 6-year-old child hospitalized with the effects of COVID-19. So, in fact, what are you seeing from a medical standpoint in terms of how this is impacting broader categories of people, and what effect is it having on them? Are younger people generally weathering this storm with few complications, or are you starting to see problems in some of those younger groups?
So I will tell you there's definitely been a shift in the epidemiology. And when I say epidemiology, I talk about the age specifically. When we initially had clusters, a lot of them were patients that were in the nursing homes. So there were patients that were admitted which were of greater than 70 years. And now we are seeing people in their 40s, 50s, 60s. In fact, majority of the people admitted to the hospitals belong to that age group. 40s, 50s, 60s. We see 30s. We've seen people in their 20s. And the complications can be just as bad. People in their 20s or 30s can get extremely sick. We've had patients who are in that age group and have been admitted to the ICU requiring ventilator support. So it can get pretty serious. And sometimes even with 100% oxygen on the ventilator, some young people are not able to keep up their oxygenation, and they have to be put on a machine called ECMO, where it's almost like a cardiac bypass. the way that machine works and pretty much oxygenates the blood. So we also have had patients get on ECMO, and it's been patients who are younger as well who've required that. So it's across the board. 40s, 50s, 60s predominantly, but yes, we do see people who are of the younger age group who are admitted to the hospitals as well. But people who are getting sick, I'm sorry, people that are getting sick are across the board.
And we've been dealing with this now for about 8 months or so. And obviously, with each passing day and week, we learn a little bit more about it. One of the things you and some of your colleagues talked about yesterday, you referred to as post-COVID syndrome, that it's not just the initial infection and the illness that many people deal with, the fatigue, the cough, those symptoms, but that there can be lingering symptoms that may stretch on for weeks or even months. How common is that, and what are you seeing?
So that is fairly common. If you include complications of a clot formation, high clot formation, it can be up to 30 to 40% of people that have COVID can have some kind of a post-COVID syndrome. And this can be anywhere from brain fog, sleep disturbances. People can have hypersomnia, which means they're excessively sleepy, or can have insomnia where they cannot sleep. People can have a lot of fatigue, just very severe fatigue. And that's where we see a lot of consultations in our clinics as well. They've had COVID a few months ago, and then they come in with post-COVID syndromes with extreme fatigue, just not able to do anything. Rehab is something that we try in patients like that. In the 4 weeks post-COVID period, there is also a dangerous entity called multi-system inflammatory syndrome, where there can be multiple organs involved. There can be a rash. There can be multiple organs with inflammatory signs that can be seen, and then steroids or special medications are needed for treatment of that. That was reported in children at first, but now we're even seeing that in adults. So there's a lot of complications that can occur post-COVID as well.
This Facebook Live event with WMAY, a virtual town hall meeting on the coronavirus pandemic. Gail O'Neill, Public Health Director, Dr. Vidya Sundareshan, the county's Medical Director. Dr. Sundareshan, we have seen an increase locally in hospitalizations. We're seeing numbers statewide that we haven't seen for several months now. But we also know that hospitalizations are a lagging indicator. We see a spike in cases, and then we may see the hospitalizations start to grow several weeks after that. Given that, and given the recent number of record days of cases here locally, what are you expecting in the next few weeks in terms of hospitalizations and the availability of beds in the ICU and elsewhere?
We are still good in terms of the capacity. So there are two indicators. One is capacity, where number of rooms, number of beds, number of ventilators available. I think if you talk to any of the hospitals, they will tell you more that they're prepared. So and it's available. Capacity is still there, but with the growing numbers in the community, increased transmission, high transmission here in the community, the hospital rates are bound to increase as well. So that's most likely coming, and we are already seeing those numbers go up. Right after the time when our numbers got down in April, our COVID numbers got down to very low numbers there. But now it's gone up again and gone up quite significantly. And it's probably going to go up further with the numbers that we are seeing in the community right now. And in addition to the capacity, there's also, I specifically want to talk about the staff, the hospital staff. The nurses, the physicians who are taking care of these patients. It is not easy taking care of patients with COVID. They need a lot of supervision. They're very sick patients. And again, with a lot of staff who may be out either in quarantine, and there are so many other factors which are coming into play because this has been going on for a long time. It's been going on now for about 8 months. it's just getting harder. It's just getting harder for everybody in terms of physician burnout, nurses, staff burnout. So that's also another issue in terms of hospitalization and care in the hospital.
Among the pieces of data that we're watching is this positivity rate, and we know the number of tests has gone up locally, but the rate of those tests coming back positive has also increased. The most recent number today, a rolling average of 7.8%, just shy of that 8% figure that if we get that 3 days in a row could trigger these additional mitigations, including temporary prohibition on indoor bar and dining service. That's been one of the most controversial things being done in response to this. I'm asking both of you, really, in your professional capacity here, if we do get to that 8%, is that sort of prohibition on indoor bar and restaurant service necessary? Is it a good idea? Are there other tactics that could be used to achieve the same results without some of the economic impact of that? What needs to happen if the numbers keep moving in that direction?
Well, I think with numbers moving in that direction, the first thing the state will ask us, or they'll call me and say, so what have you done? You've seen these numbers. What have you done locally? And we had this happen when our county turned orange one time. It was, the first time we'd ever said, well, we're failing a test number here. So the county made some more aggressive rules and guidelines, and we started seriously, we've always been serious, but I mean, spending quite a bit of time with the food establishments and trying to encourage them and teach them about the masking and the importance of all this. And it's been going on ever since. So the numbers and being on the edge is certainly where we are. And, we're concerned about that continuing. So with the press conference we had yesterday, we're trying to tell people it's important. We need their help. Certainly, we don't like the idea of having to shut down businesses, but it makes it really difficult when really the only thing we can do is try to adjust people's behavior. If they see a crowd or see no masks around people, that they just don't participate.
Dr. Sundareshan, from a medical perspective, would that sort of action make a difference? Are there other things that we could do instead if the numbers keep rising? And I believe we may have lost her for just a moment. We'll come back to that point. Gail, I want to ask you about testing as well. As we noted, there's been an increase in testing. Are we doing enough right now? Is there ability to do more? Would it be helpful to have more testing? Where do we stand there?
As a community, I think we're very fortunate. When I talk to other communities that don't have the number of testing availabilities that we have quite a few testing sites around. The Illinois Department of Public Health has committed through the rest of the month to do Saturday, Sunday, Monday here at the Health Department parking lot. We have a site that SIU is running at the Abundant Faith Church. There's Walgreens and the center on South 6th Street for the respiratory center. They're doing work. Springfield Clinic has, testing sites. There seems to be way more availability now of testing sites than there were. We also are getting, we have gotten a shipment of some of the more rapid tests, which they've talked about using for schools. We're kind of seeing where those could be best used, and that'll be something else we'll expand with very soon. So there seems to be a lot of testing going on, and we'll continue. Our ability to really know overall, as a local health department, to know exactly how many tests are being done, we don't know, but we do know the number of positive results that come in.
We're also dealing with the fact that flu season is now among us, and you have been talking a lot in recent weeks about the need for people to get their flu shots, et cetera. What kind of response are you seeing? Do we have any data on that? Are people, in fact, getting vaccinated against the flu? Are we seeing flu cases yet in the county, and how will that impact the fight against COVID?
Vidya, do you know about the flu?
Yeah, I think the response for flu vaccination has been so far encouraging, but we want to try and get as many people as possible vaccinated against the flu. You do not get the flu from the flu vaccine. The flu vaccine has a dead virus. So it's not really possible to get the flu from the flu vaccines. So it's important to go ahead and try to get as many people as we can vaccinated. The more number of people we have vaccinated, the milder our season's going to be. And it's also going to be helpful in terms of trying to keep people out of the hospital. A lot of people that have flu can also have complications from flu, which can be pretty devastating. So the more people that we have vaccinated, the less complications they can have, and it's going to be better in terms of the flu season. We are seeing quite a few people coming up for vaccination. People that are coming to clinics, we're actively giving them vaccines. And SIU, I am a faculty member at SIU. We have special flu clinics where people come and can get their flu shot morning to evening. So that's available as well. All the employees have been provided flu vaccines. So that's another thing. So yes, the vaccination rates, we want it to be as high as possible. With regards to your second question, how does that impact COVID? How does that impact what's going on with the current pandemic? Flu is a different type of a virus. It doesn't really make anybody more prone to COVID or less prone to COVID. There are different types of viruses. But yes, people can have co-infections. They can have flu and COVID at the same time. We saw that previously in March. We saw that in February. So a lot of people can have both. This time in the Southern Hemisphere, flu season has been milder because the same things that work against COVID work against the flu. Hand washing, mask wearing, watching your distance. Same things are protective against the flu as well. So hopefully, if we follow these precautions, we can definitely have a milder season for flu as well.
Along those lines, as we've been talking about the flu vaccine and people getting those shots, I know you're already looking ahead to an eventual COVID-19 vaccine. Nothing's approved yet, but the hopes are that at some point in 2021, we'll have some widespread availability. What preparations are being made, and how ready is Sangamon County for a mass vaccination?
Well, that's what we're prepared to do. We've been, ever since the early 2000s, we've been preparing for, mass casualty incidents, terrorism, bioterrorism, and preparedness. So that's been one of our underlying missions as a department, to be ready for any of those. And so what we're doing now with drive-through flu vaccines, doing that outside, is intentional for a couple reasons. One is we are limiting exposure to COVID, but we also are practicing to be prepared for the vaccination of many people with the COVID vaccine when that comes. So we feel like we're prepared. We had a lot of support in the community when we started this COVID hotlines and activities. The community pitches in together, and I'm certain that'll happen again within Sangamon County and Menard County as well.
We have several questions that have come in through our website, listeners who have put forward their own questions on this. So I want to bring a couple of these into it now. One listener with several questions, but all kind of along the same lines, asking about reporting requirements. What, if any, requirements do nursing homes have to report COVID in their facilities? Do schools have requirements? Public and private schools, are they the same requirements? And private businesses, what obligations do they have if they become aware of COVID within their facilities? What, if any, laws are governing all of that?
Well, the businesses generally have given us a call early on because they want to make sure that they have taken care of dealing with a positive coworker or employee and what they need to do some cleaning. I think what happens with some of the businesses, especially fast food restaurants, is they work in small quarters with their staff. So they not only need to clean and contact people, but they have to figure out how to continue to work with a limited workforce because of the possible exposures of many people in close contact. We were seeing that a lot more before mask wearing was as prominent as it is now, which is good news. We have quite a few things going on like that, helping with this. Vidya?
Yeah, it is actually reportable. So
Yeah.
any of the positive cases of COVID should be reported to the local health department. It additionally helps tracking to make sure that our numbers that we are tracking are done correctly. The labs which get positive tests, in fact, um, send all the system to a centralized computer system, INEDS, which tracks all the infections, the positive reportable infectious diseases. That's a system for that. And COVID gets reported in that system as well. So every positive is counted through that system. And the local health department has access to that. And they additionally get this information from the labs that are able to test for COVID as well.
And we know a lot of entities have, in fact, made this information public on their own. But just to be clear, that's not a mandate. That's not a requirement. That's just what they're choosing to do in the interest of keeping their customers informed.
I believe that's so. Yes. So businesses, whether it's a bar, a restaurant, a store, they will generally call us. They don't have to if they want some help or they just want to check in. When people get a test result, they get a result called to them by the provider. We wait, like Dr. Sundareshan said, for it to go through the electronic data system, so the employers can have at least a day or two jump on getting things under control and identifying contacts early. So the partnership of them letting us know, either the schools and the businesses, is a good thing. We've spent quite a bit of time with the schools. Our nurses have with a lot of questions because each case is a little bit different, and they have to kind of work out the risk factors and who might have been exposed and those kind of things and how it impacts school and workplaces as well.
That same listener is also asking about the back to school metrics, and we track those numbers each week when they come out on Friday, but have noted that when they update the numbers on Friday, they're only updating with figures through the previous Saturday. So there's almost a week's lag time there. And he's asking why is that the case, and why aren't we basing those metrics on updated figures updated to that day?
Well, personally, when we look at the data here, there's times where there are slight mistakes, and there's where somebody's name might be misspelled, and double check. That's kind of why we stopped reporting on the weekends, because it was very difficult to validate each positive person with their correct data. So we've been really dedicated to doing that, and the state is as well. I think in the fine print you see with their reporting that they need 2 or 3 days to make sure that it's not going to change again. So that's why you can't get an immediate. And sometimes people that are reported us are from other counties, vice versa. There's a few things, but not the majority. But there are a few things where we might not have the most accurate information right away.
A Springfield school board member, Micah Miller, submitted a question to us asking about the state's announcement last week that there was 170,000 Abbott Labs rapid antigen tests coming to the state to be distributed to local health departments that would be distributed based upon need for a number of localized needs, including K-12 settings, asking if the Sangamon County Department of Public Health has received any of those tests yet, or know when they might be arriving and how they'll be used.
We have just received those. They came in late Friday. There's quite a few little details that you have to kind of be able to do to be able to use the test, as far as having somebody that can do the reporting back through the lab system and have some knowledge of how to run the test. Just have somebody in charge. They have to have a waived laboratory status. Not really hard to do, but there's just another step, whoever's going to take this on. We heard about the schools being included. And then I had heard that the schools were going to be sent their own shipment. So those are the kind of things that we are looking at right now, and we'll hopefully get some out to the communities as they need it. I know some of our medical facilities are kind of running a little short of supplies, so maybe we can fill in the gaps there, but that's something we're looking at this week to get it going.
In the remaining time, just a couple of final questions here. I'm hoping each of you can address some of the still pretty common misconceptions that are out there, including one that's just come up again over the weekend of the claim that COVID stats may be exaggerated because hospitals and doctors make more money the more COVID cases they have. Can you debunk this?
Yeah, I would like to quote what was recently presented at the Infectious Diseases Society of America. a conclusion slide, and I'm going to read verbatim from that. It says COVID-19 pandemic has increased a physician workload with approximately one third taking on new responsibilities and a similar proportion reporting increased work hours as a stressor. Much of this additional work is uncompensated due to the economic impact of the pandemic on the healthcare system. Simultaneously, many physicians across the US have suffered adverse economic impact in the form of furloughs, job loss, and reduction in pay. And these circumstances pose a risk for burnout and diminished well being among the US physicians. In infectious diseases physicians have experienced higher workload but less economic impact related to increased need for their expertise and new roles and responsibilities. So it's just a lot of work all around. And as far as the tests go, the tests are accurate, and we repeat tests when the diagnosis is not clear. A lot of times there are people that have symptoms which are very suggestive of COVID. They may have a negative test. There are tests, the way interpreting tests is also an art. And we constantly review this as the physician groups, all the physician organizations here. We look at them together and make sure we are interpreting these tests correctly. We are making sure we give good care to the patients and use the resources that we have in the most optimal way.
Another thing we see popping up a lot on social media, this stat that was running around claiming that something like 96% of COVID deaths are not actually COVID deaths because the people had underlying conditions, the comorbidities, etc. When someone has other health conditions and then contracts COVID and ultimately dies, is it in any way inappropriate to classify that as a COVID or a COVID-related death?
Sorry.
Go ahead.
Can you hear me?
Yes.
Yeah. There with any mortality, there's always a primary cause and a secondary cause. If the mortality is secondary to COVID, it is definitely reported as the primary cause. And then there are secondary causes. If there's somebody with an underlying cancer or heart disease or severe lung disease from other conditions, lung cancer, something else, that is also reported on the death certificate. So COVID is definitely reported, and people who have these comorbidities have a higher chance of mortality from COVID. So yes, it definitely needs to be taken into account. Dr. Zike had mentioned this earlier. In fact, sometime in March or in April or May, when they were counting, they're cleaning this up and definitely counting what needs to be counted. But it is important to remember that there are primary and secondary causes, and COVID, when as a cause, will get counted as a cause because that can make it worse in somebody with comorbidity.
As we are winding down here, we're getting ready for the holidays, and that's going to mean a lot of events, a lot of family gatherings. Traditionally, it's meant that anyway. What can you tell people about those sorts of activities in this upcoming holiday season? What do people need to keep in mind? Can they have these family gatherings? How can they do so safely?
Well, the Illinois Department of Public Health has put out some really good guidelines about the holidays and things to make it as safe as possible. You can find that on their website. All those guidances that come out, we also put on our website, the scdph.org website. I actually learned quite a few things even reading the new guidance that I hadn't thought about. We know we want to be together with family. We need to think about our older family members, and what we might be taking to them is way beyond a cold. But the things that you can do to make it a little safer is if you are having multiple families, and they're coming together, and you want to set the people that live together in the same tables with at least some distance of possibly 6 feet if all possible, where everybody can kind of hear and talk, but to keep the family members segregated that way a little bit. Of course, masks would help. We're not used to doing that with our families. Maybe they could decorate them or something for each family group, but it's something to try to get everybody used to. Instead of having buffet lines, maybe serving food that's already plated, so there's less opportunity for close contamination with people or food supplies. Doing as many things as outside as possible, but if it's based on somebody like today, it wouldn't be a very good day for trying to get everybody outside to have a little bit of outside time. Dr. Sundareshan, did you notice any?
Yeah. Gail, I'm just going to repeat a lot of what you said. IDPH has fantastic guidelines. CDC has really nice guidelines. If you were to just Google holiday guidelines, IDPH, Illinois Department of Public Health, or holiday guidelines, CDC, you'll get to these websites, and it's really nice. Like Gail mentioned, outdoor is always better than indoor, but with the weather, that's not really always possible. So if you want to have family get-togethers earlier in the day when it's still warm and you can still do something outside, that's something to give a thought to. Make sure you have hand sanitizers available, frequent use of hand sanitizers, and washing your hands as much as possible. Try to avoid hugging and and high fives. So just waving and things like that are recommended. I know it's hard, but it's definitely recommended, especially if you're not in the same safety bubble, the same group of people that you've been hanging out with. The other thing, of course, would be travel. If there's any travel involved, then you have to look at where they're coming from. If you are going somewhere to an area where there's not so much COVID, then make sure you have arrangements for monitoring yourself, especially if you're going to visit somebody much older and more vulnerable. So all these need to be taken into account as well. And with regards to shopping, if you can do online shopping, well, that's the safest. But if you were to go to a store, make sure you're wearing your mask, make sure you watch your distance. Those are some things that you can do to avoid getting infected and staying safe during the holidays. I've said this before, but with the shovel, with the furnace this year, we have to bring on our safety act for the holidays as well. Halloween time, particularly, make sure you look at those guidelines. They're very nicely written, very well thought out. When you go out, prefer to go with people that you have been with, the same safety bubble. Don't hand out candy. If you want to do something, individually wrapped bags or small packets can be put at the end of the garage, and then you can still have fun looking at people that are dressed, walking around, and make sure that you're not really touching those candies or handing them personally to them. And finally, hand sanitizers. Make sure you carry your hand sanitizers with you when you're going trick-or-treating.
And we'll go ahead and post that link on the WMAY Facebook page here in just a few minutes as well to make it easy for people to find it. Finally, before we let you both go, and I know you've been delivering this message every day for months now, we're going to ask you to deliver it one more time to talk about the importance of those 3 W's we hear so much about and how it can, in fact, make a difference in finally bringing this pandemic to an end, or at least getting it under control.
So we need you to wear your masks, watch your distance, and wash your hands. And then Vidya's added the last one that's not a W, and that's get your vaccination. Start now with the flu vaccine, and then when another one becomes available, we'd appreciate you doing that.
Absolutely. Yeah, wear your mask, wear it properly. Make sure you have your nose and mouth covered. Masks are protective. There is enough data from all over the world. Masks do work. They do protect us. That's all we have at this time that we can follow to keep us safe. There are treatments for COVID once somebody has the infection, but you want to prevent it. You want to protect yourself. And these strategies really, really do work. Wearing a mask, watching your distance, and washing your hands. Make sure you keep that 6 feet distance. It's hard, it's tempting, especially when you meet your friends, especially when it's youngsters, the teenagers. You guys can do it. You really can do it. Please, please make sure you pay attention to the 3 Ws and 1 V, which is the vaccine. Get your flu shot and wear your mask, watch your distance, wash your hands frequently.
Sangamon County Public Health Director Gail O'Neill, County Medical Director Dr. Vidya Sundareshan, thank you both so much for taking part in this virtual town hall event. We appreciate your efforts very much and all the information here this evening, and I'm sure it won't be the last time we're talking to both of you about this as we continue to make our way through this pandemic. Again, on behalf of all of us here on WMAY, thank you all for tuning in, and we will be in touch soon. Thanks again to both of our guests as well here this evening, this WMAY live Facebook event.
Thank you, Jim.